Well, autism spectrum disorder is more and more frequently being framed as a difference, autism spectrum difference. And there are varying symptoms and severity of autism. You may have some people on the autism spectrum who are out in the community, having families, working, and there are others who may need more supports and perhaps even 24-hour-a-day care. Autism often comes with a number of concomitant or comorbid conditions such as intellectual disability, Tourette syndrome, depression, and some others. People who are autistic, we may see difficulties or challenges in social interaction, getting along with classmates, colleagues, neighbors, family members. And at this time, the subtypes have been removed in favor of levels of severity. So we'll see autism levels 1, 2, and 3. Some of the red flags that we see for autistic people might be difficulties in communication. So that person may not have developed a reliable means of communication. That person may be non-speaking, although non-speaking doesn't mean they don't have something to say. And we can now use assistive and augmentative communication devices to help that person communicate. We may see challenges in behavior, difficulty in understanding what is appropriate behavior, and we're also going to see sensory issues, where some of the senses are turned up too high and too much information comes in, and other senses are turned down too low, where that person isn't receiving enough information. Some of the symptoms that parents will see include a delay in speech. There'll be differences in eye contact. Eye contact is often difficult for autistic individuals. That person may not respond to their name. That person may not be able to follow a point. They may not point themselves. We'll see a lack of joint attention, or in other words, awareness of another person who's paying attention to the same thing that they are. Imaginary play might be lacking, so that child will not understand the concept of putting a doll to bed and covering the doll up so that they can sleep. Autistic people interpret language very literally. You might see repetitive behaviors, self-stimulatory behavior, which is now being reframed as self-regulatory behavior. We'll often see autistic people lining up objects. Sensory sensitivities, so lights and sounds may be too bright, sensations may be too strong. Often we'll see tantrums or meltdowns, and later on we'll talk about what the difference is between the two, even though they may look very similar. We'll also see deep interests. Formerly, they've been classified as obsessive or restricted interests. But if we look at them as deep interests, then we lay the groundwork to working with those interests as opposed to against them. The implications for being autistic or having autism are what I call the 4 A's of autism. And these 4 A's include awareness, acceptance, appreciation, and action, to put it all together. Autism means that the child will need immediate services for early intervention, supports. Many of us on the autism spectrum will need to be taught skills that most people pick up automatically. Intensive education, especially early in life, customized for the person's needs, and focusing on how we can provide the best quality of life, both for the autistic individual, for the family, and others involved in supporting that individual. We also need to be looking at inclusion. What can we do to include that person in the community, be it school, community, work, or at home, and also focusing on adapting to the needs of the autistic individual. We need to focus on providing a nourishing environment where the autistic person can learn and function to their greatest capacity. Early intervention is vital. There are 2 main categories The first is comprehensive treatment method, and these are intensive therapies. They form a bit of alphabet soup, such as applied behavior analysis, or ABA, TEACH, which is teaching and training of autistic and communication handicapped children. We also have daily life therapy, the Miller method, floor time, relational development intervention, and CERTS, which stands for social communication, emotional regulation, and transactional supports. We also have techniques such as what we see being applied by occupational therapists, speech language pathologists, and other people who focus on providing supports for autistic individuals. Early intervention, the sooner the better. While the brain remains plastic throughout life, neuroplasticity is greatest when the person is young, and then we will have better chances at having meaningful involvement of that autistic individual in society. We maximize the abilities of people on the autism spectrum by finding their strengths. So asking the question, what does that person like to do? How do they spend most of their time? So instead of focusing on deficits, disorder, and disability, we need to be focusing on the ability of autistic individuals. And in that way, we can focus on what the person can do. Some of those abilities include a good memory, adherence to routine. Often we are very logical. And just like everybody else, in order to live a meaningful life, that means using our strengths to promote success. So the team for the autistic child includes the parents, other family members such as siblings, may also include a doctor such as a developmental pediatrician, case manager, school psychologist, perhaps a psychiatrist as well, the teacher, other students, advocates, speech, occupational, and therapists such as for the comprehensive treatment methods that I mentioned earlier, such as ABA, Miller method, and various others. Another person on the team that we must also remember is that the autistic person is a vital part of that team.